in the days ahead.
All right, thanks, Jim. You know, you're going to be busy in the next couple of days here. Well, with the hustle and bustle of the holidays, it's easy to get distracted here and overlook something very important. We're talking about potential pet hazards, so don't let this little girl end up on the naughty list here. And Indyvet's Dr. James Speiser and Rosie are here now. As I understand it, emergency vet visits really spike this time of year, not necessarily because a pet is ingested chocolate or something, but foreign objects that are a real danger.
That's exactly right. You know, the pet insurance industry has actually identified that many more foreign body ingestions occur during the holiday season than any other time of the year.
Okay, we've got kind of a striking picture that really I think will hit home for you if you're watching here this morning. This was a pet that came to you with some kind of obvious symptom that something was wrong.
There we have an X-ray, and there's something in the stomach. Can you tell what that is, Ray?
Okay, so it's that rectangular object. Looks like a battery.
It is a battery, exactly.
Wow.
And that was in the stomach, and in that particular situation, we were able to go in with a scope and pull it out. But if that would get in the intestine, that would then require surgery.
Okay, so batteries, I can't imagine a dog swallowing this whole. It must have been a kind of a biggish dog here. What are some of the other objects to really
You know, there's lots of different things, like hair ties, like we have here. I actually pulled out about 15 of those last week out of a dog's stomach. Little socks
15,
like this.
yeah.
15 of them.
Okay.
Socks.
My dog does this all the time, and these are on the floor all the time in my house, especially in the bathroom.
String and ribbon that we all have during the holidays. Cats and dogs both like to ingest that. Icicles off the Christmas tree. Christmas ornaments are also interestingly ingested. Not really sure why. And then, of course, little bouncy balls and things like this that we have that toddlers will have. Dogs like to run and grab those, and of course they'll swallow them.
Okay, I have a question. This is what they can ingest here. How do you know that they've ingested that? They're not going to tell you that this is something that I swallowed here. What are the things to be watching for?
You know, most of the time what we'll see is vomiting, or they will quit eating. Abdominal pain also, if they just hurt and they're retching, that is a common symptom that we'll see.
So what do you usually have to do when then you get a dog or a cat to the vet table? What do you typically do to get them healthy again?
Well, certainly what we need to do is we'll take x-rays. Sometimes we'll ultrasound them. We'll identify that there's a problem there. And then if we can retrieve it with an endoscope, we'll do that. And if we can't, then we have to do surgery. And most of the time it's successful. But if we have something that gets in the intestine and causes a perforation, then that's a life-threatening situation.
You saw Rosie's ears just went up right there. Really quickly, we only have a few seconds left. You've got an event that's happening that people can help out the Johnson County the Humane Society.
Exactly. At Indyvet and at several other sites that are on the screen, we have bins where people can donate food, cleaning supplies, various things that the Johnson County Humane Society would need, that we have a list on our website, and then we donate all that at the end of the holiday season.
Wonderful. Dr. Speiser, thanks so much. We've got information about that and more on the hazards here at fox59.com. The link is right there at our homepage. Have a great holiday.
Thank you,
Dr.
Ray.
Speiser. We'll see you later. All right, Ench, over to you.
Hey, Ray, thank you. Yeah.